Hello, this is Brad Hayden, and today we'll be discussing the healthcare crisis of the 1960s and 1970s. One of the biggest issues facing the U.S. during this time was the steep increase of healthcare costs. For example, national health expenditures per capita nearly doubled from 1965 to 1970. Furthermore, the government's share of national health expenditures jumped from 26% in 1965 to about 37% in 1970, totaling at about $27.8 billion. While at first, many saw these increased costs as a valuable investment in the health of Americans everywhere, eventually, a sense of skepticism developed. With little to no improvement in many significant health metrics, people began to believe that these costs were simply too high. So how exactly did costs get so high? In The Social Transformation of American Medicine, Paul Starr posits, the tolerance of the market for higher prices allowed costs to increase. Higher incomes and higher expectations were partly responsible for that increased tolerance, but the key was structure of financing. Specifically, Starr cites 4 reimbursement policies that were crucial in raising the cost of medical care. They are cost-based reimbursement, lesser of costs or charges, usual and customary costs, and fees for service. First, as the name cost-based reimbursement implies, Medicare and Medicaid chose to reimburse hospitals based on their costs. Thus, any doctor or hospital who sought to minimize their costs was also minimizing their revenue, which is completely illogical. Thus, cost-based reimbursement was a huge incentive to keep pushing up the cost of medical care. Similarly, providers could also be reimbursed on a fee-for-service basis. Therefore, the more services they provide, the more these providers make, creating an incentive to increase the volume of their services. Starr calls this policy the central mechanism of medical inflation, as doctors begin to provide services to patients that they don't really need. In addition, instead of setting up a fixed fee schedule, Medicare paid doctors according to their customary fees or prevailing or reasonable charges for services in that specific area. However, many younger doctors who had no set fee schedules began to charge exorbitant rates for their services, with older professionals soon following. This led to incredible inflation in medical fees. This leads to increased specialization in medical fields, as doctors find winner services that provide more income than a lot of low-cost services. Additionally, we see more doctors move to wealthy areas, as the customary fees in these areas are usually larger. Finally, we see a combination of these policies, as providers are reimbursed for the lesser of the actual cost incurred for treatment or their customary fees. This only serves to drive medical costs up even further. In conclusion, the American healthcare system is one of excess, where we want the best doctors, facilities, and treatments that money can buy. However, ever-rising costs makes this problematic. Measures taken during the 70s to stem these rising costs were not effective for a variety of reasons. Which begs the questions, are there any ways we can stem the further rise of medical care costs today? If so, what are some potential obstacles that we may face in doing so?